guys, good evening. I think it's around 5:30. Yeah, and I think this is the last weekend of January. January has been extremely long. How are you doing? Welcome back to my channel. My name is Lizzie, and thank you so much for the support, for the new subscribers. Each day I wake up, I find a +1, +2, +3, and I don't take it for granted because it is out of goodwill, good heart that you people are supporting me and watching my videos. I don't take it for granted. I really appreciate you and may God bless you. So, the last time I did a video on Pipera, it was on Wednesday, yeah. It was on Piperium and then I set the wrong premiere time. I do forget to edit PM and AM. Imagine like a video in a run. And I go up at 12:50, 12, so 12 a.m. Who will even watch that? And it's being on a weekday, so I think I need to work on that. And if you haven't watched, please go watch. Ladies especially, what to expect when your body gets back to its own pregnant state at delivery, period that is 6 weeks post delivery. And I learned a lot from it because these things I read. Actually, I'm even with my book here. Nasoma kidogo, and then once I pass out, I don't tend to forget, so inakuwa rahisi for me and you to know these things. And today we want to do something called wound care and burial sepsis. We are still in the reproductive phase. I'm so much fascinated with the reproductions. Nilisema hii mwaka lazima nikuwe mama. Sio lazima, but by God's grace, I wanna be a mama. So I'm reading these things to be entitled. So in that case, let's just get to the video. And if you haven't subscribed, please subscribe. Please subscribe. I have a lot of distractions, so I keep on moving my head. I want to be caught unaware. Ngoja anakuja kama amefungua mengi. So yeah, let's do this. So, wound care. How do you care for your wound? If you had a normal delivery, there's some people who don't get tear, but of course, if you don't get it, remember you're having low care. Low care ni ile maji natoka, damu nini after mtoto ametoka, lakini it is normal. And you have to be of high hygienic standards because failure to do that, you'll have this bad, sijui kupronounce it, is it odor or odor? I think it's odor. Yeah, bad smell. So you have to protect you have to keep yourself up to standard, hygiene, kuoga, matiti pia. You should avoid, if you're a CS mom, this is a hack I was told by a colleague who had a CS before, and it's something that you never been taught in class. I don't know, maybe us, but it is something that you never taught. It is a hygienic fact. Don't ever let your breast milk to drop on the CS scar. It will have some problem in healing. So make sure your wound is in a dry place. Sijui kama ni dry cool place. And then if you are a CS mama umejifungua, avoid putting on heavy clothes. Tunavaa nylon nini. Do a cotton. If it's cotton, some even funga leso, like the past for the 1 week. You funga leso, like you need to be free. You need to be free, of course. So the wound area should be dry. That is a CS mom. And then another hack I was told, of course, and then you avoid straining your wound because tear tena. And then another hack is when you're discharged. The other time I had a patient who's now my friend, and he delivered CS, and then I can declare dawa she never bought. Like 5 days post CS, she came, the wound was bleeding. I asked her, did you get this medication? I mean, don't be that ignorant. Don't be that, I want to use the vulgar language, but don't be that ignorant because CS is not something to joke about. You have to take care of it. Hii ni kidonda imekatwa, and kidonda needs medication. it won't heal by itself. So you see, that is why pus was coming out. So I prescribed some drugs for her for like 2 weeks, and gladly she's doing better, and I'm happy. And she was in pain. Can you imagine her kununua just because aliambiwa kuhosi hakuna, and anunua nje akaandikiwa. But for her, she didn't buy. When some people end up saying nilifanya hivi na sikupewa madawa, but tuliandikiwa. So sometimes put yourself first. Ukiambiwa enda andika, it is up to you to take that initiative to go check out for the drug. So that is it. And then these are like, okay, I'm talking about the natural hacks outside before I get to my notes. The normal delivery, the episiotomy, you had a tear. African moms, kitambo, if your mom, kitambo, if you had like a home delivery, you had a tear. It's the same thing to the hospital. Hospital you'll be stitched. At home, you won't be stitched. But what will happen? You will heal. You will heal. So it is always said that you take, even a first time mom, you don't know these things, like me. Sometimes I find it quite interesting. I ask my mom this question, and she tells me, get a basin, wekelea maji, okay, put water and salt, and then like this hot water, steaming water, alafu like you sit on it. I know it's a bit uncomfortable. A friend of mine has told me it's not an easy thing that tunaongeanga. You sit on it, alafu hiyo maji, they know the sodium chloride. Sodium husaidia kukausha kidonda. So the sodium chloride will help the bond. It will heal up quickly, and then at the same time in absorb your maji, the wound ikiingia, najua inasaidia kukausha haraka, the pores will healing man's language. Kikalia maji ya chumvi, kuchome itasaidia kukauka haraka. So that is it. And then now let me get to my notes. I'm just like reading as we explain a little bit of it. Then you have, okay, now this is the wound care. Wound care, especially episiotomy or CS. This is what happens in the hospital. You see this pregnant mom, okay, delivered mom, umejifungua post CS, post SVD, post assisted vaginal delivery, umejifungua. You are being told to walk. It is very uncomfortable, no uchungu, lakini advise the mother to ambulate early, especially after CS. Mama na mshonga anaambiwa jaribu kutembea. Why? Then always examine curved muscles to prevent deep venous thrombosis. Sexual activities can resume from the 6th week. But my friend told me she tried, I think, from the 7th week, and the contraction was painful. So kindly, boy child, men, don't force. If we don't pretend, you cannot pretend when it comes to pain. You cannot lie. I don't think so. In as much as wamesema from the 6th week, not like 1 month, 2 weeks, I don't think someone can pretend when it comes to pain. Sidhani kabisa. So some patients may experience dysphoria. Dysphoria is actually painful sex, painful penetration. Huyu mother amejifungua 6 weeks, mimi hata siwezi kubali. Utangoja tu for the next 3 months. Anyway, then you follow up the patient in the 6th week. Of course, now this 6 weeks, that is like the preparium period, whereby I did the last video where the body is getting back, the ovulation, the vagina, how is it, those changes that takes place. And then you advise the mother on cervical cancer screening. Then at the same time you advise the mother on the best family planning method, because you can get pregnant. Kwanza the 6th week hii, unajua mbona wanakuanga na mahanja sana, so don't take it for granted. Okay, welcome back. So puerperal sepsis. Puerperal sepsis is infection of the genital tract following delivery. Genital tract following delivery. And umezaa normal, let me not try to explain it. You've given birth through vaginal delivery. Let me call it vaginal delivery. You've given birth through CS, but there's some things that are not ready to go the correct way. It happens. This is something that happens. And then you end up getting an infection, either of the wound wound or the vagina. So in this case, who are at risk? Everything has a risk. Nani unaza risk hii kitu? Then who are the risk factors? Who are like that bracket of people who might end up getting the viruses, getting the infection? Um, if you had a prolonged labor, more than 12 hours, umekuwa na labor, membrane will rupture, but bado cervix haijafunguka, you're at risk of getting puerperal sepsis. And then you had a premature rupture of the membrane. Membrane ijafika term, it is premature preterm or premature rupture of the membrane. Membrane ilipasuka kabla siku zifika. You've had multiple vaginal exams, more than 4 vaginal exams. So it happens, especially in a government setup, not private, but okay, it happens in any setup. Let me just not say like government, private, these stories that are multiple VAs. Wanakuja wanapima kidogo, umefunguka uko 2 cm, umefika 4, tena umerudi maybe 2, umefika 6, yani it's like it keeps on fluctuating, so they keep on checking. At the end of it all, we can forget to give antibiotics because it's not like that 100% sterility in the stars. Unakuja unaangalia kidogo, umerudi tena. Those too many VAs. And then instrumental deliveries, maybe forceps, they might be contaminated in a way or two, so you might forget that. Not really forget, but it might end up giving you an infection. Okay, operative deliveries, patients who undergo CS, yes, and then retain products of conception. For instance, placenta imekataa kutoka, you're at risk of getting sepsis. And then, how does a patient come in? Utajuaje, you as a person, and then me as a healthcare worker there, how will I know this person I'm probably classifying this as a puerperal sepsis? This patient is within 6 weeks post-delivery. Ushajifungua, of course. You've already had your baby. And then the patient has no abdominal pains. Not even supposed to have them. It should be mild, kidogo tu, zikienda zikienda, but now they're not reducing, they're getting more intense. A vaginal discharge, which is like foul smelling, like the first warning sign. The discharge, which you're supposed to be like releasing, removing, toka, should be lochia. And by the 7th, 10th day there, 1 week, lochia is not supposed to be foul smelling. And foul smelling is like something like, let me use the worst. She's scared of your samaki. Samaki, not fried one, fresh. Shombo, something of such. It doesn't smell good. And you can imagine being around food, such kind of like a foul, bad smell. Yeah. Prolonged one type of lochia, if it's blood, imekataa kuchange. Within the first 3 days, haifai kukua, inafaa kumeenda brownish. So it is like bloody all through. Haitaki kubadilika. And then suddenly postpartum hemorrhage, you are bleeding. I think this goes hand in hand with the lochia because of like bleeding. The discharge coming out ni damu, inanuka, it is a red flag. And then systemic manifestation of infections, have headache, fever, body weakness, body malaise, mwili imechoka, unasikia kichwa inauma, non-stop headaches. Don't say nimejifungua na CS ni kawaida, it is not kawaida. And then wound infection. For the case of the episiotomy, maybe it is kuna pus hapo, CS wound kuna pus, you see, it is infected, so you cannot ignore it. So let's see how we manage this. I want to go into the etiology, the causes, of course, pathology, but let's just look at the risk factors to tumeangalia who are at risk, the clinical, like signs and symptoms, that is, signs and symptoms of how this sepsis might come about, and what period is a person so much at risk of getting puerperal sepsis. So let's see how you can handle this, and then the advice you can give to the mother. Welcome back. So first, let's see the management, supportive management and specific management. this patient ako kwa uchungu. You, me as a mother, I'm in pain. What am I supposed to be given? I need antibiotics. I need analgesics or painkillers because I'm in pain. You see, I'm having headache. Probably my pressure might be high. I need my pressure checked. If this blood is coming out in the postpartum hemorrhage, of course I need to be admitted and I need fluids. I need my HB levels checked. I need my complete blood count done to see if there's an infection. I need my leukocytes to be seen. Are they high? All these things will be seen in the blood test. And then I need to do an ultrasound. I need to have an ultrasound done to me to see if there are some products of conception. Come on, maybe it'll happen. Placenta ikutolewa. This ultrasound will have to determine. Will have to show. I'll have to do a high vaginal swab for microscopic culture and sensitivity. I have to do wound sepsis. That wound. I have to check the swab to go see if to do sensitivity to kama kuna infection nyingine ama tuna manage the wrong thing. Then yeah, of course, this is an infection. We need a broad spectrum antibiotic, and the drug of choice is usually ampicillin, gentamicin, metronidazole. Those are the drug of choice, and of course, you need painkiller. The best choice for a painkiller, depending on how the doctor will prescribe to you. Then you out there, you and me, what can we do for these infections? Because this is something we can prevent. One, prophylaxis. Give prophylaxis antibiotic appropriately where necessary, i.e. when you're having a prolonged rupture of membrane, when you're having like multiple VEs, and then you make sure that the procedure is aseptic to avoid infection. That's where the whole problem began. And then you minimize the VE, vaginal examination, and then proper management of third stage of labor to avoid retained products of conception. So I said proper management of third stage. Third stage of labor hapa ni penye mtoto ashatoka from delivery of the fetus to delivery of the placenta. These are septic techniques apply. If you see why we did an ultrasound to see if there's a retained product of conception, maybe placenta libaki, maybe. So we need to rule out that on the ultrasound. But now when it comes to the third stage of labor, you need to check. You need to be very careful. You need to monitor your vitals. You need to get the pressure down. You need to control the postpartum hemorrhage. You need to check out on the lochia, and then you need to advise the mother to massage the fundus, get warm fluid. You see, and now that's the pressure as well. So you're not focusing on the mother to avoid these things. So if you fail to manage third stage properly, that means it will bring about all these complications. Timely diagnosis of intrauterine infections. Timely diagnosis. Failure to do that, ushajifungua, it was not diagnosed earlier, it leads to all these complicated things. Imagine I have learned one or two. This is something I was reading and reminding myself, and I feel like it is important for me to share out. If you're planning to be a mom, another thing, choose your story. Make your create that friendly environment so that if you're going there for a clinic, at least unasema he will see for my visits. So you have that environment friendly with your staff. Choose the hospital wisely. Prepare in advance. Never keep quiet. If there's something wrong, ask. Siku hizi tuko kwa mtandao wanauza maswali mengi. You feel so much challenged, so you need to be on the lookout, be educated, and be smart. Thank you so much, guys, for watching it. That was it. I was reading about prenatal sepsis and the wound care. Remember, from umejifungua usiseme kukalia maji ya basin ni baridi, ni moto itanichoma, I feel uncomfortable. And then when you pass in urine, my mom told me, you hold your legs, then unachenda vitu zingine ukianza kufikiria, you give another second thought of never have a baby. end of the day you need them. See you tomorrow. Tomorrow is on Sunday. Okay, see you on Sunday. Okay, see the time I'm going to premiere this video. And keep safe. Sanitize. Remember, health is wealth. Until then, Nambiswa is out. And enjoy your lovely Saturday, the last weekend of January.